Good afternoon. This is All India Radio. I am Valsa Williams and with me is Rupinder Kaur Chawla with the Midday News. The headlines. Second nationwide COVID-19 vaccination dry run underway in 736 districts of 33 states and union territories. National COVID-19 recovery rate improves to 96.39%. Health Minister says government would eradicate COVID-19 from the country as polio was eradicated. Government and farmer unions hold 8th round of talks in Delhi today. And in cricket, Australia were all out for 338 against India on the second day of third test match at Sydney. As the nation fights the COVID-19 pandemic, we begin with a message of precaution to stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki doori for social distancing, focus on hand and face hygiene. And now the news in detail. The second COVID-19 vaccination dry run is being held throughout the country today. The massive mock drill is being conducted in 736 districts across 33 states and union territories. The objective of this dry run is rehearsal of the actual vaccine administration process. The entire planning of the vaccination drive, including beneficiary registration, micro-planning and vaccination at the planned session site, will be tested under the leadership of the district collector or district magistrate. The dry run will also familiarize the state, district, block and hospital level officers on all aspects of COVID-19 vaccination. Our correspondent reports that around 170,000 vaccinators and 3 lakh vaccination team members have been trained in the process to be followed at the vaccination sites.
The country's drugs regulator has approved Covishield and Covaxin for restricted emergency use in the country. The first round of dry run was held across the country on 2nd of this month. The exercise is being done to ensure efficient planning and management for vaccine delivery in each district. The second dry run will be held in 736 districts across 33 states and union territories except Uttar Pradesh and Haryana. Each district will identify 3 types of session sites similar to the previous dry run, including public health facility, private health facility and rural or urban outreach site. With Dipendra Kumar, Anupam Mishra, AI News, Delhi.
The Union Health Minister Harshvardhan yesterday appreciated the tireless efforts being made by the multiple stakeholders, including the central and state government officials and the medical community. The minister highlighted the unique digital platform Co-Win, repurposed from the eWin platform, that will provide real-time information of vaccine stocks, their storage temperature and individualized tracking of beneficiaries of the COVID-19 vaccine. The minister reassured all his state counterparts that the country's cold chain infrastructure has been sufficiently upgraded to ensure last-mile delivery and that adequate supplies of syringes and other logistics have also been provided for. Dr. Harshvardhan requested the health ministers of all states and union territories to be vigilant against rumours and disinformation campaigns regarding the safety and efficacy of the vaccine. Speaking to news persons after meeting the Tamil Nadu Chief Minister Edapadi Palanisamy, Dr. Harshvardhan said that before 2025, tuberculosis would be eradicated from the country. He told that Tamil Nadu has been a forerunner in eradicating the disease. He also told that the centre had permitted 11 additional medical colleges in the state this year. He also said the centre would give 100% support to all the activities carried out by the Tamil Nadu government.
In Assam, the COVID-19 vaccination dry run drill is being carried out across the state. Senior officials of the health department are visiting the session sites to monitor the progress of the dry run. A report from our Guwahati correspondent.
This is the third COVID-19 vaccination dry run in Assam. Prior to this, dry run was conducted at Nalbari, Sonitpur and Kamrup metro districts. Today, dry run is being conducted at 3 health institutes in each district. 5,000 nurses would be engaged in the first phase of vaccination. Another nearly 3,000 medical officers also to be deployed as observers. Training will be held for security personnel as they would be deployed at vaccine storage points. COVID-19 vaccine will be stored primarily in Guwahati at 8 vaccine stores along with 5 regional vaccine stores before sending to the district level. Manas Pratim Sharma, AR News, Guwahati.
In West Bengal, COVID-19 vaccination dry run is underway all over the state. In each district, mock drill is being carried out in 3 places, including important health centers and medical colleges and hospitals. In Kolkata, 5 medical colleges and hospitals are taking part in the dry run. Meanwhile, 18 deaths were reported due to COVID-19 in the past 24 hours, taking the toll in the state to 9,881. In Bihar, dry run of COVID-19 vaccination is being conducted today in all 38 districts of the state. Health Minister Mangal Pandey said dry run is being conducted at 4 places in Patna and in 3 places each in remaining districts. Vinod Kumar Singh, Superintendent of Nalanda Medical College Hospital, NMCH, Patna, told AIR that hospital is ready to store 15 lakh vaccine vials at a time.
मैन्युफैक्चरिंग यूनिट से लाइक सीरम इंस्टीट्यूट पुणे से अगर वैक्सीन चलता है तो वो हवाई जहाज से आता है एयरपोर्ट पर। एयरपोर्ट से हमारे यहाँ जो फ्रीजर वैन है उसके थ्रू यहाँ पहुँचता है और फिर हम WIC रूम्स हैं हमारे यहाँ उसमें उसको स्टोर करेंगे और फिर यहाँ से उसी तरह से वैन से डिस्ट्रिक्ट लेवल पर जाएगा और डिस्ट्रिक्ट से PSC लेवल पर। तो वैक्सीन डिस्ट्रीब्यूशन एंड स्टोरेज का जो तंत्र है बिहार सरकार का वो पहले से माकूल है और मजबूत है।
In Uttarakhand, dry run for COVID-19 vaccination is being undertaken in 130 health centers across the state today. It also includes private hospitals. According to health officials, teams of doctors and paramedical staff are on duty to see that all arrangements are in order. District administration officials are also visiting the centers for making on-the-spot assessment. In Himachal Pradesh, dry run of corona vaccine has been carried out at 36 centers of the state today. The dry run of the vaccine has been done at 3 centers in the state capital Shimla, including IGMC, Ghanahatti and Mashobra. 25 people have been administered the dummy vaccine at each of the 36 centers in the state. Each of them were kept on observation for half an hour. In Rajasthan, dry run of COVID vaccination is being held today at 102 centers in all the 34 medical districts of the state. All guidelines laid down by the centre regarding the dry run are being followed. More from our Jaipur correspondent.
The first dry run held at 18 centers of 7 districts on 2nd January remained successful. Health Minister Dr. Raghu Sharma told that all the work related to training, distribution and storage has been completed. He told that physical verification of 3,000 centers has been done. Meanwhile, there is a continued dip in the corona cases in the state and the recovery rate has reached 96.6%. The number of active cases has also come down to 7,468. Jitendra Dwivedi, AIR News, Jaipur.
In Maharashtra, the COVID-19 vaccine dry run is being carried out in over 30 districts and 25 municipal corporations. According to the state government, the dry run is being conducted at 3 healthcare centers in each district and 1 center in municipal corporation limits. State Health Minister Rajesh Tope said that adequate training has been imparted to ensure a smooth dry run. A report from a Mumbai correspondent.
The second round of dry run carried out in Maharashtra is an important step before the actual vaccination drive. It has also been done to detect logistical issues that may crop up in the immunization process. All aspects of the immunization process is thoroughly followed in the dry run with the help of senior health officials. State Health Minister Rajesh Tope has said that Maharashtra will take nearly 3 months to complete the first phase of COVID-19 vaccination for 8 lakh people in the state, the data of which he said has been uploaded on the CoWIN app. Coordination between the health, police and education departments will be assessed during the dry run. Meanwhile, in Pune, 15,000 health workers will be inoculated in the first phase. Besides, 180 vaccine centers will be set up for this immunization drive. Kunal Shinde, AIR News, Mumbai.
Gujarat is undertaking COVID-19 vaccination dry run along with nationwide dry run today. After 3 successful dry runs in the state recently, today's dry run will cover the entire state. AIR Ahmedabad correspondent reports that the state administration, along with the health department, are fully geared up to start the COVID-19 vaccination.
Earlier dry runs carried out in Gujarat were on a limited scale and in selected districts. Now today's dry run will cover the entire state on a full scale. Gujarat government has set up around 40,000 vaccination booths in all 33 districts of the state. These vaccine booths have been set up in government hospitals, civil hospitals, district hospitals, public health centers, urban health centers, private hospitals and schools. 16,000 medical staff have been trained for vaccination work. Today's dry run will also ensure the smooth transportation of storage and vaccine. Beneficiaries for the first phase of vaccination have been identified. Yogesh Pandya, AR News, Ahmedabad.
The second phase of COVID vaccination dry run, the largest such drill undertaken so far, is being conducted across Andhra Pradesh today. The lessons learned from the earlier exercise will be put to use to execute another dry run. More from our Vijayawada correspondent.
The first vaccine dry run was held on 28th and 29th December in Krishna district in Andhra Pradesh, along with 8 districts across the country. To test the planned second vaccination, mock drill is going on in Andhra Pradesh today to ensure that the state can undertake a successful vaccination program in a bid to stop the spread of coronavirus. Dr. G. Kondalrao, AR News, Vijayawada.
COVID vaccination dry run is being conducted at 263 places in Karnataka today. Instead of 3 locations in each district, 7 locations have been chosen for the dry run. There are 24 district hospitals, 20 medical colleges, 43 taluk hospitals, 31 community health centers, 87 primary health centers, 30 urban primary health care centers and 28 private health centers across the state that are conducting the dry run. Speaking to media in Bengaluru today, Health and Medical Education Minister Dr. K. Sudhakar informed that the state is fully geared up for the actual vaccination. More from our Bengaluru correspondent.
The Health Minister Dr. Sudhakar is close that state will receive 13,90,000 vials of COVID vaccine in a couple of days. He inspected the dry run today in various health centers and said 6.3 in both government and private sector have registered for vaccination, and those frontline warriors who are left out can still register for the vaccination. He informed that 10 walk-in coolers, 4 walk-in freezers, 3,201 ice-lined refrigerators, 3,039 deep freezers, 3,312 cold boxes, 46,591 vaccine carriers and 2,25,749 ice packs are available to carry out mass immunization. The central government has also provided 64 ice-lined refrigerators. Sudhindra, AIR News, Bengaluru.
In Telangana state, the second dry run of COVID vaccination has begun this morning at 1,200 centers across the state. In Hyderabad, the dry run is being held at 260 centers in both public and private healthcare facilities. It may be recalled that the first dry run was held at 7 centers in Hyderabad and Mehboob-Nagar districts in Telangana a week ago. Our correspondent says the problems arise in enrolling beneficiaries of vaccination in 14 out of 33 districts in the state. More from our Hyderabad correspondent.
Almost all major public and private healthcare facilities in Telangana state are taking part in today's COVID vaccine dry run, just ahead of the actual vaccine rollout expected to take place in the coming few days. About 30,000 healthcare workers and frontline COVID warriors, besides a few citizens, are taking part in the dry run. All the phases and processes of the vaccination are being tried out and monitored carefully in 1,200 centers across the state, including 260 centers in Hyderabad alone. However, the public health authorities are trying to resolve the technical issues that cropped up relating to CoWIN mobile app in several districts, and the same has been brought to the notice of the Union Health Minister yesterday. The state authorities are hopeful that the enrollment issues will be resolved soon, as the final simulation of the vaccine rollout is aimed at fine-tuning existing systems laid out for efficient planning and management of the actual immunization process. Lakshmi, AIR News, Hyderabad.
Union Health Minister Dr. Harshvardhan today announced in Chennai that polio vaccination drive in the country would begin on the 17th of this month.
Expert group on immunization in consultation with the international health authorities, we have decided that on 17th of January, we are going to have our national immunization days for polio which will run for about 2-3 days. The first day will be dedicated to every mother taking a child to the polio kendra for vaccination, followed by another 2-3 days. This is very, very essential to ensure that we are able to maintain the overall immunity level of our country, particularly pertaining to poliomyelitis.
The health minister, who is on a 2-day visit to the state, told media that the government under the leadership of Prime Minister Narendra Modi will end COVID just like the eradication of polio. He said that since the Narendra Modi government took proactive steps to control the spread, the incidents and the fatalities were reduced considerably, prompting the attention of the world. He said that the centre had opened 2,300 testing centres throughout the country, which had worked 24/7 to test scores of samples to confirm the disease. He said that more than 1 crore people have returned home safe after treatment of COVID-19. The minister lauded the Tamil Nadu government for taking swift measures in controlling the spread of the virus. The minister also reviewed the presentation on the action taken toward containing the spread of the virus.
The government has said that the vaccination for COVID-19 is voluntary. The Health Ministry has come out with a series of frequently asked questions about COVID-19 vaccine on various aspects. The ministry said it is advisable to receive the complete schedule of COVID-19 vaccine for protecting oneself and limiting the spread of the disease. Infected individuals should defer vaccination for 14 days after symptoms resolution, as they may increase the risk of spreading the virus to others at the vaccination site. The ministry said the vaccine introduced in India will be as effective as any vaccine developed by other countries, as various phases of vaccine trials are undertaken to ensure its safety and efficacy. Eligible beneficiaries will be informed through their registered mobile numbers regarding the health facility for vaccination and its scheduled time.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Second nationwide COVID-19 vaccination dry run underway in 736 districts of 33 states and union territories. National COVID-19 recovery rate improves to 96.39%. Health Minister says government would eradicate COVID-19 from the country as polio was eradicated. Government and farmer unions hold 8th round of talks in Delhi today. And in cricket, Australia were all out for 338 against India on the second day of third test match at Sydney. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
Welcome back to the Midday News. The 8th round of talks between the representatives of farmers' unions and the government is underway in the national capital. Union ministers Narendra Singh Tomar and Piyush Goyal, who are representing the government, met Union Home Minister Amit Shah earlier in the day before meeting the farmers. In the earlier meeting on the 4th of this month, Union Agriculture Minister Narendra Singh Tomar had said the government wanted farmer unions to discuss the 3 farm laws clause-wise, but they could not find any solution as farmer unions remained adamant on the repeal of these 3 laws. The government has repeatedly assured the farmers' leaders that it is committed to address their issues and both sides need to take steps forward to arrive at an amicable solution. Mr. Tomar had reiterated that minimum support price MSP and the mandi system will continue like before. Speaking to media before attending the meet, the Agriculture Minister Narendra Singh Tomar expressed hope that the talks would be held in a positive atmosphere and a solution would be found. He said during discussions each side has to take steps to reach a solution.
The country's COVID-19 recovery rate has reached 96.39%. During the last 24 hours, more than 20,000 COVID patients have recovered. The total number of recoveries has gone up to over 1,37,000. Health Ministry said the COVID-19 recovery rate of India is amongst highest in the world. It is 89.36% in Brazil. In Russia, it is 81.17%, Italy 70.68%, USA 59.59%, and UK is 47.44%. The actual caseload currently comprises only 2.16% of the total positive cases. Presently, the total number of active cases in the country is around 225,000. Flights between the United Kingdom and India, which had been suspended since the last week of December amid the new coronavirus strain concerns, resumed today. A flight from the UK with 256 passengers landed in Delhi at 10:30 in the morning. Earlier, the flights from India to UK was started again on 6th of this month. The Civil Aviation Ministry has informed that 30 flights will operate between the two countries every week. All the passengers from the UK flights deboarding at the Delhi are undergoing necessary COVID-19 tests. The passengers have been asked to keep a gap of 10 hours between their arrival from Britain and the connecting flight to other cities.
The News Services Division of All India Radio in its bilingual live phone-in program tonight will bring you a special discussion on COVID-19. Dr. N.N. Mathur, Director, Lady Hardinge Medical College, will participate in the discussion. Listeners can ask questions to the expert on toll-free telephone number 1800115767. You can also ask questions on telephone number 01123314444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard on FM Gold channel and additional frequencies from 9:30 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. In Madhya Pradesh, the administration has ordered closure of poultry shops in Neemuch and Indore districts for a week after bird flu infection was found among chickens in these areas. Director of Animal Husbandry Department, Dr. R.K. Rokde, said that after crows, avian influenza has spread to poultry. More from our Bhopal correspondent.
The State Veterinary Department has informed that bird flu virus was found in chicken samples from Neemuch and Indore. Samples of crow carcasses from 7 districts also reports presence of bird flu virus. So far, the virus has claimed 222 crows in Indore district and over 700 in the state. The state government has directed authorities in Indore and Neemuch districts to immediately close all poultry shops for the next 7 days. They have also been asked to collect samples of migratory birds from near water bodies and send them to Bhopal for testing. Meanwhile, Collector of Indore, Manish Singh, at a meeting on bird flu, informed that a control room has been set up in Indore to monitor the situation. In other districts also, preventive measures are being taken. Survey by health department teams is being conducted in affected areas to check people with symptoms of cough, cold and fever. The health department says that no bird flu patient has been found till date. Pooja P. Vardhan, AIR News, Bhopal.
In our special series Year Ender 2020, today we bring you a report on the initiatives taken by the Textile Ministry. The year 2020 has witnessed a number of initiatives undertaken by the government for the textile industry. Our correspondent reports that these initiatives not only aim at strengthening the textile sector, but also making India Atmanirbhar and protecting the environment. A report.
National Technical Textiles Mission has been approved with a total outlay of 1,480 crore rupees with a view to position the country as a global leader in technical textiles. India has emerged as the second largest PPE manufacturer in the world through concerted efforts to deal with COVID-19 pandemic. Brand name and logo for Indian cotton was launched as Kasturi Cotton India to attain the objective of making India Atmanirbhar and vocal for local in the field of cotton. In yet another step towards Atmanirbhar Bharat, National Action Plan was prepared to promote Indian toy industry, including handicrafts and handmade toy products. Need-based interventions have been sanctioned for overall development of the toy industry in 13 identified handicrafts toy clusters. Many more initiatives are being undertaken for handicrafts and handloom sector. Ministry of Textiles is developing an e-commerce platform through Digital India Corporation to provide direct marketing platform to handicraft artisans and weavers. Artisans and weavers are also being registered on government e-market portal to enable them to sell their products directly to government ministries and departments. formation of handlooms producer companies is being facilitated. Government has undertaken to develop craft villages in select handloom and handicraft pockets of the country on important tourist circuits for integrated sustainable development of handlooms, crafts and tourism. A total of 12 crafts villages have already been identified. Initiative for replacement of plastic bags with low-cost eco-friendly jute bags were also undertaken. Pragya Devra, AIR News, Delhi.
The 16th Pravasi Bharatiya Divas will be organized tomorrow. This one-day virtual convention will be inaugurated by Prime Minister Narendra Modi. During the inaugural session, President of the Republic of Suriname and Chief Guest Chandrika Prasad Santokhi will address the participants. The valedictory address will be delivered by President Ramnath Kovind. The theme of this 16th Pravasi Bharatiya Divas is Contributing to Atmanirbhar Bharat. More from a correspondent.
Pravasi Bharatiya Divas is celebrated once in every 2 years, which provides a unique platform to engage and connect with the overseas Indians. January 9 was chosen as the day to celebrate this occasion because it was on this day in 1915 Mahatma Gandhi returned to India from South Africa. After his arrival, Mahatma Gandhi led India's freedom struggle and India got the independence. The first Pravasi Bharatiya Divas was organized in the year 2003 to mark the contribution of overseas Indian community in the development of India. This convention provides a forum to discuss issues and concerns of the Indian diaspora and honor those individuals who have made exceptional contribution to various fields. During the 16th Pravasi Bharatiya Divas convention, names of the Pravasi Bharatiya Samman awardees will be announced. 15 winners of the Bharat Ko Janiye quiz will also be announced during the convention. The winners will be invited for the India's tour after the COVID-19 pandemic. Bhupendra Singh, AIR News, Delhi.
In cricket, India were 96 for the loss of 2 wickets against Australia at close of play on the second day of the third test match at Sydney. Earlier, the hosts were all out for 338. Ravindra Jadeja took 4 wickets for the visitors, while Stephen Smith scored 131 runs for the hosts. The hosts had won the toss and elected to bat on the opening day. The 4-match series is currently levelled at 1-1, and if India manages to win this test, the side will retain the Border Gavaskar Trophy, even if Australia goes on to win the last test at Brisbane. In the Union Territory of Jammu and Kashmir, advisor to Lieutenant Governor Farooq Khan convened a meeting to review all arrangements to be put in place for the second edition of the Winter Games under Khelo India program, besides the International Himalayan Snow Race. The mega national event will commence from February the 11th and conclude on February the 16th at Gulmarg in Kashmir.
Delhi, Punjab, Haryana and Rajasthan continue to face cold conditions, while due to abundant moisture and lower tropospheric levels, dense fog is also forecasted in North Indian region tomorrow morning. Due to fresh western disturbance in mid and upper tropospheric levels over western parts of Afghanistan, Punjab, Haryana, northeast Rajasthan and west Uttar Pradesh may experience rains today. Rainfall is also expected over southern peninsular India over the weekend, including Tamil Nadu, Puducherry and Karaikal due to cyclonic circulation over southeast Arabian Sea.
Now let us take a look at the weather update for today. The national capital will have a generally cloudy sky with light rain or drizzle. Minimum temperature was recorded at 11 degrees Celsius, while maximum will be around 19 degrees. Mumbai will have a partly cloudy sky. Temperature will move between 27 and 32 degrees. In Chennai, rain or thunder showers would occur towards afternoon or evening. The temperature is likely to hover between 24 and 29 degrees Celsius. Kolkata will have a partly cloudy sky. The city observed a minimum temperature of 18 degrees Celsius, while maximum temperature could reach 31. Srinagar will have a generally cloudy sky. Temperature will hover between 0 and 8 degrees Celsius. Jammu city will witness mainly clear sky, becoming partly cloudy towards afternoon or evening. Minimum temperature was 12 degrees, while maximum will be around 20. In Leh, there will be partly cloudy sky. Minimum temperature was minus 6 degrees Celsius, while maximum is expected to be around minus 0.5 degrees. Gilgit will have a generally cloudy sky. Temperature will hover between minus 2 and 9 degrees Celsius. Muzaffarabad will have a generally cloudy sky. Temperature will move between 4 and 18 degrees Celsius. Dehradun will have thunderstorm with hail. Temperature will hover between 14 and 22 degrees Celsius. And now, before we end the bulletin, the headlines once again. Second nationwide COVID-19 vaccination dry run underway in 736 districts of 33 states and union territories. National COVID-19 recovery rate improves to 96.39%. Health Minister says government would eradicate COVID-19 from the country as polio was eradicated. Government and farmer unions hold 8th round of talks in Delhi today. And in cricket, Australia were all out for 338 against India on the second day of third Test match at Sydney. And with that, we end the midday news.